The last of the three therapists this week, the major therapists we are looking at from the 60s and 70s, is the work of Fritz Perls, labeled Gestalt Therapy, which he defined as a theory of contact, of figure forming at the contact boundary in the organism or environmental field. And as we go through this review of Perls's work, we'll find that his focus was heavily on the client's awareness and presence in the here and now. This was a philosophy, perhaps you might say, that became very popular Asian or Eastern philosophy during the 1960s that looked at this idea of being present in the here and now. Certainly there are other streams that lead to that, but we'll kind of review how Perls developed his ideas over time. Perls developed and popularized Gestalt therapy. He was born in Berlin in 1893, to older middle-class German Jewish parents who he had two other siblings. He was a problem child and often in trouble at home and in school. He failed the 7th grade twice and was asked to leave school. Later, he studied medicine at age 23 and left his studies to serve in World War I as a medic and raised in the ranks to an officer in the German war effort. After completing his medical degree in 1920, he worked as an assistant to Kurt Goldstein at the Institute for Brain-Injured Soldiers. Interestingly, this TBI has a long history. In fact, they even labeled it a term quite similar back in 1920. Perls favored Goldstein's view using Gestalt psychology that focused on the soldier's perception of themselves in their environment. So here we have some precursors to the social work person and environment perspective, which is essentially what he was talking about here in certainly a early 20th century focus. Later, Perls worked at the Institute in Frankfurt and met his future wife Laura, who was 12 years younger. Perls was trained as a psychoanalyst at Vienna and Berlin Institutes of Psychoanalysis. His analyst was Wilhelm Reich, who was influenced in Perls' development of Gestalt therapy. Perls was also influenced by Helene Deutsch, Otto Fenschel, and Karen Horney. Both Karen and Otto were contemporaries of Sigmund Freud as well. Perls met Adler, Jung, and Freud. In 1934, due to the rise of the Nazis, Perls immigrated to South Africa, where he continued his research and practice. There he established the South African Institute for Psychoanalysis in 1935. Interestingly, he was influenced by the work of Jean Christian Smuts, who wrote Holism and Evolution. I found the book a few years ago and I have a copy of it. What I like about this concept is it developed what our ideas today are about the holistic approach to working with clients. Interestingly, too, at the time, or just previous to that, Mahatma Gandhi also resided in South Africa for a period of time as well, and also had a relationship in terms of philosophical discussions with Smuts as well, who was rather famous in South Africa during that era. After spending 12 years in South Africa, Perls moved to New York City and established the New York Institute for Gestalt Therapy in 1952. He visited several cities and countries, establishing Gestalt training centers in Miami, San Francisco, Los Angeles, Israel, and Canada. Between 1964 and 1969, he was an associate psychiatrist in residence at the Esalen Institute near Big Sur, California. I was in 8th grade and graduating to high school in 64 and graduated high school in 68. And I remember Esalen wasn't far from where I grew up, down along the Monterey Peninsula, about maybe 100 miles from where I grew up. And so I remember Perls hanging out in Carmel, California with several other psychoanalytic and psychotherapy gurus of the time. In 1969, he moved to Cowichan Lake on Vancouver Island in Canada and died about 6 months later in 1970. So just out of the era of the 60s, which was really the height in some ways of his work. His writings include over time Ego, Hunger, and Aggression, 1969, Gestalt Therapy, Excitement and Growth in Human Personality, Gestalt Therapy Verbatim, a very popular book during the 1960s. I remember scanning it in the late 60s while I was exiting the high school era. In and Out of the Garbage Pail, another popular book at the time, and The Gestalt Approach, 1973, which was a post-mortem publication of his work by, I believe it was his wife, Laura. Fritz and Laura came to New York and established the Gestalt Institute for Gestalt Therapy, as we said earlier, in 1952. And it's the original Gestalt Therapy Institute. In the late 1940s, Frederick Fritz and Laura Perls immigrated to the United States and settled in New York City. Here they continued their work begun in South Africa, developing a novel theory and method of psychotherapy. In 1951, the therapy was named and presented to the world in Gestalt Therapy, Excitement and Growth by Fritz Perls, Ralph Hefferlin, and Paul Goodman, all associates of his through having met him at the Institute in New York City. Moving now to the focus of Gestalt Therapy, kind of a quick overview here. It focuses on the here and now. And Fritz used the I-thou approach to interactions, which was posited in a book by the same title, authored by Martin Buber, a Jewish philosopher, theologian. It's a very seminal book, and I encourage you to read the book if you have time after you graduate. I think it's a wonderful discussion of what Perls incorporated into his therapeutic method, concentrating on the process rather than what could or should be going on. In other words, Perls was more focused on the process of the interaction rather than on what the content was. In other words, what the person said was not as important as how the person said it, one might say. And the person or the patient was encouraged to take responsibility for what he or she was doing during the encounter. And as you'll see with Perls and Gloria in the tape, he observes that she's kicking and moving her body, and he's asking her what it's about. This is kind of an example of what you might think of when you hear this idea of process versus what she's saying. It's what she was doing that was speaking louder than her words, in a sense. And again, the immediate present awareness of one's experience. So staying in the present is a key element of Gestalt work. And then explanations of causes or purposes are rejected. So he's not so much interested in the why of what she's doing, it rather the how. In other words, what she's doing in terms of the process. And you'll notice that quite markedly as you observe the Gloria movie. In Gestalt therapy, the only goal, again, as I said, is awareness. That's the key element. That means an emphasis on the now literally means teaching the patient how to get into and stay in the awareness continuum. So being aware and being not only aware, but one's process, as he talks about, one's behavior in terms of how they're communicating with the therapist. The actual experience of any present situation does not need to be explained or interpreted. It can be directly contacted, felt, and described. And again, this whole experience of what is the body doing and responding to in terms of the communication experience would be a major concern. And then looking briefly at mechanisms of Gestalt psychotherapy. Perls talks about focusing, which is this idea of staying in the present or awareness, and may ask the client a question: what are you aware of or experiencing right here and now? That's an opening to kind of begin to experience what the person is thinking, how they're responding to what they're hearing themselves say in terms of this process orientation. He also wanted to focus on enactment. Here the client would be asked to experiment by putting feelings and thoughts into action. This includes role play, psychodrama, or the empty chair technique. Again, in the Gloria tapes, you're going to see this very clearly. He asks her to role play with him and to lecture him in some ways, as one example. But there are a number of role playing and psychodrama kinds of experiences, as well as the empty chair technique, where he tells her to speak to someone in the room who may not be present, and then to respond back as to what she believes the person might say. He uses himself as well. When she's angry with him, he asks her what she would want to say to him, and then what would he say back. An interesting technique. I find this to be an extremely powerful technique. I demonstrate it in my clinical practice with individuals and groups classes, and I found the technique to be very effective. I've had it used on myself a couple times with my spiritual director, and it's a technique I encourage you to learn about and perhaps use in your own practice when appropriate. Then he talks about mental experiments, guided fantasy, and imagery. And Perls says, visualizing an experience here and now increases the awareness more effectively than enacting it. So rather than having the client enact an experience, he has them center down, close their eyes, and visualize the experience. Very important, because as we see those visual images of what we experienced, we also have an emotional response to what we are viewing, and that all is an important aspect of the process. Then he talks about body awareness. This is a very important element of therapy, not only in Gestalt but in other therapies. A lot of times he has the client focus on their breathing patterns, because as he says, rapid breathing tends to make one off balance, and anxiety, he suggests, may emerge from breathing that is not centered. So centered breathing he likes to focus on as well. In the here and now, you're breathing in and out in a fashion that's centering and calm. And then he talks about loosening and integrating techniques. So fantasy, imagination, or mentally experimenting where the opposite of what is believed can be helpful breaks down rigidity. And again, observe this with the Gloria tape with Fritz. He does some of this technique by having her look at what she is resisting in terms of the opposite of what she's suggesting and how she responds to him. This is a brief overview of Perls' techniques. And again, I encourage you, if you have time, to read some of his major works